Good afternoon and half a day. The Committee on General Government Operation, Appropriation, and Housing is now called to order. For the record, today is Tuesday, June 15, 2021, and the time now is 2:00 p.m. Notice for this budget hearing was disseminated via email to all senators and all main media broadcasting outlets. First public notice was issued on June 7, followed by June 10th, and today is June 15. The committee will hear and accept testimonies on Bill 55-36 COR, the fiscal year 2022 Appropriation Act as requested by the Governor, relative to the Guam Behavioral Health and Wellness Center fiscal year 2022 budget request. Joining me for this budget hearing is Senator Amanda Shelton, and I know my other colleagues will be joining in shortly. The general rules for this public hearing: those testifying on behalf of Bill 55-36 COR relative to the Guam Behavioral Health and Wellness Center are the Director, Teresa Ariola, and she has Debbie Polino and Carissa Pangilinan. Neither one of them are the Deputy Directors, right? Oh, you are. Then the Deputy Director also. Great. Written testimony shall be submitted to the committee. Please provide my legislative staff with your written testimony for photocopying. Testimonies may be read, and lengthy testimony should be summarized to about 5 minutes, but we'll allow you all the time you need. This afternoon is on Guam Behavioral and Health and Wellness Center. Those testifying will be allowed to present oral testimony. Once you're done, please remain in the room for question or for additional testimony as may be desired by members of the committee. We're also joined by Senator Chris Duenas. Questions and testimony shall be confined to the substance or nature of the agenda, which is your budget. Personal inference as to the character or the motive of any senator or any individual testifying is not permitted. Any violation of this general rule of conduct will result in removal from the budget hearing. Proper form and decorum shall be practiced by all present in the public hearing room for these proceedings. Individuals who fail to maintain proper form and decorum may be restricted from providing oral testimony and or may be asked to leave. They will be asked to leave the room. We're also joined by Senator Joanne Brown. When you speak, please make sure that the microphone is on and that you speak into the microphone. And you please state your name. Ms. Ariola, after you've done your presentation and your staff, if they're going to speak, please state your name, and then you won't be required to keep repeating who you are after that. At this time, I ask the panel from the Guam Behavioral and Health and Wellness Center to please rise, and for our sergeant at arms to please swear them in.
Can you raise your right hand? Under penalty of perjury, do you affirm that any and all information that you provide today, whether it be verbally, electronically, and in writing, be the truth, the whole truth, and nothing but the truth, so help you God? Mr. Chair, they're all under oath. You may proceed.
Thank you, Sergeant Arms. And Ms. Ariola, I noticed you got maybe 100 slides to your, but that's okay. I know you don't, but thought I'd tease you a little bit. But please present your testimony about on your budget. Thank you.
Thank you, Mr. Chairman. Joseph Agustin, senators who are present, Senator Amanda Shelton, Senator Joanne Brown, Senator Chris Duenas. Thank you so much for being here and hearing our presentation for our FY22 requests, budget requests. So my staff and I prepared a presentation, a PowerPoint presentation. So if I could ask, thank you very much. And I'll just go right into our presentation. Today is June 15, 2021. Next slide, please. Guam Behavioral Health, I'm going to give you an overview of all the services we provide the people of Guam. Under clinical services, we have adult outpatient, which is part of community support services, and adult counseling is a part of that. Talaika is a grant that caters to 16 to 25-year-old young adults who are experiencing mental illness or serious emotional disturbance. LINK is a grant that caters to 5 to 18 years old of homeless youth or youth who are experiencing serious emotional disturbance and is at risk for homelessness. August grant is in Chamorro. August is to call, so it's what's part of the August grant is crisis intake, crisis hotline, and our mobile response teams. Under clinical as well is residential recovery program. That involves 4 residential homes that Guam Behavioral Health oversees. Probably one of the most popular programs under clinical service is drug and alcohol, better known as New Beginnings. I think everyone knows it at New Beginnings. It is the gateway to residential recovery programs that are contracted to NGOs such as Sanctuary, Oasis, and Lighthouse Recovery. It's drug and alcohol. New Beginnings program is outpatient services as well. And our 3.7 inpatient detox program that is very excitingly going to be opening next week. And of course, you can't have Guam Behavioral Health as the state mental health and substance use authority on Guam without our professional services. We have our psychiatry, psychologist, and our pharmacists. A large division as well as the department is our Children and Adolescent Service Division known as I Maga'hågan. And this is the division that takes care of our youth who are experiencing serious emotional disturbance. Our nursing division oversees our crisis stabilization units known as the adult inpatient unit and the children inpatient unit, as well as the warrior unit. We call it the warrior unit, but it's really the isolation home that we have been able to stand up late last year. Nursing division also oversees medication clinic for all our outpatient service consumers. We have our crisis services. Of course, Healing Hearts is under that, and we are the only Guam Rape Crisis Center here on Guam, the only rape crisis center on Guam. And last but definitely not least is the prevention and training branch of the department. And under that, we have the Guam Focus in Life that is locally funded by this body, as well as federally funded by SAMHSA, that focuses on suicide prevention, as well as our PFS and SAPT grants that work through NGOs to address prevention in alcohol and drugs. Next slide, please. Some highlights for our FY21. As I mentioned earlier, we were able to renovate the isolation unit known as the Warrior Unit, or also known as TGH, the Therapeutic Group Home. This is a home that Guam Behavioral Health has and has been vacant prior to 2019 when we came on board. It was funded by, the renovation was partially funded by the COVID emergency grant that we received, as well as the Office of the Governor. So I want to thank the Governor for their support. We now have a beautiful, beautiful home that's it's the street right next to Guam Memorial Hospital emergency room. And it's currently our isolation home, but it's the future when COVID goes away. It is the future home of Serenity, which is our youth home that we handle as part of the residential program, but that we are currently renting. But it is the future home, and it's beautiful. National Suicide Prevention Lifeline Center, we were able to obtain this certification or this recognition in just January of this year. If you remember, 1-800-273-TALK, 671 callers from Guam with 671 area code would call the 1-800 line, and they would, prior to us being a Lifeline Center network partner, would not be able to loop around and get local services at Guam Behavioral Health. But today, because we are a National Suicide Prevention Lifeline Center network partner, that people with a 671 area code that call the 1-800 number will be answered in the Guam Behavioral Health and Wellness Center crisis number. So you know that they will be getting local services. The 988 grant planning started in March of this year, and this is nationwide. Congress had passed a 988 effort in making sure that the mental health and suicide crisis hotline in every state and territory is only a 3-digit number called 988, similar to 911 for medical and safety emergencies. This is going to go into effect in June of next year, but beginning October of this year, everyone on Guam would need to start dialing a 10-digit number, which means instead of giving out your 7-digit numbers, we have to start everything with 671. So that will start in October, but June of next year, working with our telecommunication partners. And again, this is nationwide effort passed by Congress a couple years ago. By June of next year, instead of calling our 7-digit crisis hotline number, people on Guam or anywhere in the United States will be able to call their 988 number for mental health and suicide assistance. The contracts transferred to DISID was completed in May of 2021, or I should say the memorandum of agreement was signed in May of 2021. And we can talk more about that, and you'll see that in the reduction of budget and contracts. Very excited, and it couldn't come at a better time. The Department of Correction Memorandum of Agreement, agreement in response to the Governor's Executive Order 2020-21 was signed just last month again in May, and this is to stand up mental health and substance use programs for those in the criminal system. I am proud to announce that the entire Guam Behavioral Health and Wellness Center just came out of a CARF resurvey completed last week. 3 days of grueling, 3 surveyors from a CARF accreditation team analyzed and looked into our policies, our procedures, as well as our programs. And even though it is not official, because we have to wait for the official word, all indications show that it was a great survey. Matter of fact, one of the highlights of the surveys is that none of our clinical programs had any recommendations by the surveyors. None of our clinical programs. 3.7 detox unit that I've been talking about, it feels like forever, is finally opening next week on June 22nd. Professional staff recruitment is constantly ongoing. As you all know, psychiatrists, psychologists, they are nationwide positions that is very, very hard to fill. But we are excited to announce that we are processing 3 psychiatric nurse practitioners who have prescription authority, as well as a medical doctor for our 3.7 unit. The construction and RFP of the DNA 3-story building, as well as the RFP of the renovation of cottage homes, is a partnership with GURA. That we're looking at an RFP. We're processing the requisition right now, and we're looking at an RFP being put out for interested A&E firms for July next month. Very excited program that we've been working on is the Guam Psychology Intern Program in partnership with WICHE. Why did we pursue this? In support with the Office of the Governor, it was very clear to me, again, that psychologists is a very difficult position to fill. Nationwide, it is just, there is no one to hire. It's just a difficult position to fill. So we need to grow our own core of psychologists. So we are putting together a Guam Psychology Internship Program for for those in their 4th year in college who are seeking this educational track. They'll be able to do their internship program here at Guam Behavioral Health, with a promise and automatic graduation for position here at Guam Behavioral Health. So this is about growing our own sons and daughters who have chosen the track of psychology to making sure that they have a job and a home to come to and serve their own people. Federal grants, I just can't say enough about my professional staff. We don't have per se grant writers on the staffing pattern. We have clinicians that have come together and have become proficient grant writers, and we seek grants, federal grants, as much as possible that fit the need of our needs, rather than looking for money and then developing a need for that. So federal grants is very, very aggressive in pursuit. Next slide, please. As I mentioned, CARF accreditation, we were supposed to be, Guam Behavioral Health was first accredited. It's the first Gov Guam department that was accredited in 2017. And it was supposed to be resurveyed last year, but because of the pandemic, we asked for a postponement. And again, as I mentioned earlier, we just came off of it, and it was a very great experience. We added one new program to the 2017 survey, and that's Serenity, our youth step-down home. The exit report indicates satisfaction and renewal of maximum of 3-year accreditation. They looked at us and compared us to 1,640 standards, nationwide standards. GBHWC received about 20 or 30 recommendations, but the good thing, as I mentioned earlier, is all clinical programs, which means service programs, had 0 recommendations. And most of these recommendations were already fixed before the surveyors actually ended. Simple things like adding a word or 2 into our policy to making sure we're in compliance. Surveyors, the 3 surveyors expressed that support from top island executive leadership is evident and should be commended. So again, I want to thank our governor and lieutenant governor for all their support, because Guam Behavioral Health, Carissa and I would not be able to do what we do without the support of this administration. A comment of the consumer comments that the surveyors actually did private interviews with is Guam Behavioral Health saved my life. Guam Behavioral Health was there when I needed someone to talk to. They also surveyed confidentially staff. And just a quote from a staff comment is, they are happy with the leadership at the helm, no longer working in silos within the department, but they now feel like one family. Next slide, please. I mentioned this as one of the highlights of the department, again, in response to Executive Order 2020-21. It's to stand up mental health and substance use programs for clients in the criminal system. We had contracted Dr. Deborah Pino. She's a renowned national consultant that Congress listens to, that national bodies refer to help us properly stand up the program in a correctional facility for the correctional population. The MOA was signed again in May of just last month. A total of 5 FTEs of personnel from the Department of Corrections budget will be transferred and is in progress. These are personnel that were working in the mental health program that the Department of Correction was overseeing, but because the Department of Correction is coming out of that business and giving it to us that rightfully this is our forte, these 5 positions will be transferred as a lateral transfer to Guam Behavioral Health and Wellness Center. The additional funding that clearly is needed for the DOC program has been committed by the administration, and ongoing talks with the administration is happening about that. Next slide, please. The snapshot snapshot of clients served. You see before you a slide of FY 2020, and then in the lower half is FY 21. FY 21, of course, is just year to date because we're not completed. The alarming numbers is that 9 months into the fiscal year, our numbers are just, if not greater, or just at par to the entire last fiscal year of 12 months. What does this say? What does this mean? Our people of Guam are ill. We are feeling the ramifications of COVID and the pandemic. And very similar to my fellow healthcare agencies, the public health and Guam Memorial Hospital that was really, really in the forefront in prevention and reacting to the COVID crisis, Guam Behavioral Health is the department that I would say is going to be handling the aftermath of the crisis. So as you can see, very alarming for the drug and alcohol stats. Last year, 12 months, or last fiscal year, we had 514 clients. This year, to date, and we're not done, we still have 3 more months to go. We're already at 845 clients. Next slide, please. A snapshot of our crisis hotline. As you know, during the pandemic, the crisis hotline was the conduit for our people of Guam to be able to access assistance in a very safe manner. From March of last year to December, we had 6,005 calls coming through the crisis hotline. January of this year to the present, we have 3,597. The National Suicide Prevention Lifeline calls, as I mentioned earlier, that's the 1-800 call that 671 residents would call, received 141 calls. That is really, really high, but the nice thing about that is now we're capturing calls from 671, where prior to January of this year, when we became a prevention lifeline partner, we were not capturing it. And so our local residents who are calling the 1-800 number did not get closure and loop back to Guam Behavioral Health for follow-up services. I wanted to give you a snapshot of the pharmacists. As you know, in the first year, November of 2019, we hired Guam Behavioral Health's first pharmacist, full-time pharmacist, I should say. They've always had part-time pharmacists. So if you look at the prescriptions filled in 2019, there was 6,392 prescriptions filled. In 2020, that's from August to June of this year. And why August is because yes. That's when our new pharmacists came on board in FY20. We had 9,213 prescriptions filled. This fiscal year alone, October to June of this year, we have 10,578 prescriptions filled. What does that mean? Is that we are seeing it correlates with the increase in the hotline, correlates with the high rate and high census in the department, and it's showing that people are getting help and getting the medication they need. Next slide, please. And of course, our budget summary. Local funding, a total of $20,772,812. You can see the breakdown. Operational budget of $16,394,369. General fund is only at $366,919 for a total of $20,772,812. I want to add that we have the federal grants total here for $17 million in awards. But currently in play, we have $15,909,571 of federal dollars in play, for a total operational budget of $36 million, $682,383. COVID-19 funding, $6.472 million. Of that, $373 is from CARES Act, and you can see the breakdown of the other grants that we received. That total $6.472. I do want to say, in response to our consumers and our staff, Guam Behavioral Health requested and was approved as a vaccination clinic. And so every Thursday for our consumers and the employees, family, and friends, we are vaccinating. To date, we have 278 employees. 211 are fully vaccinated. 5 are first dose, for a 78% vaccination rate for our department. Next slide, please. And this is the breakdown of all the grants that I had mentioned in the earlier slide. And you can look at that at your leisure. You will see that mental health and substance use is supplemental grants are coming in the droves. I want to thank the Biden administration because they made it very clear that mental health and substance use funding is going to be a critical component in their budget, and we're feeling it. So we're getting a lot of support from our nation's capital. It continues to the next slide. And in the next slide, I want to just show you that the pending grants awards is $750,000. And it's pending awards because we have not been awarded, but all indication shows that we're going to be getting it. It's in the process. Next slide, please. Again, human resource, we're at 278 employees. 178 are classified. 100 are unclassified. 186 are direct service, and 92 is indirect service. And I just listed our hiring platforms. Next slide, please. Regarding billing, we are working to update the 2012 fee schedule that I will be presenting to the Guam legislature this year, because we are working off the 2012 fee schedule. When I first entered the department, we were still using the 2012 fee schedule. So we were working on updating that and presenting it to the legislature for review. We are pending signature agreements with private insurance. We will definitely, our application is tentative submission is this year for CMS. So that will allow us to bill Medicare and Medicaid. Currently, we are only billing Medicaid. Services are provided regardless of the ability to pay. No one is turned away, of course. I wanted to highlight that. We are building capacity in our billing division or department. We have hired 1 additional claims specialist, which is a total of 2, and pending 1 recruitment. These claims specialists are new to the department. And that is probably why prior to 2019, billing effort was very, very limited. We needed to make that a priority. We also procured an external biller to be able to capture 12-month back billing in Medicaid. And next slide, please. Last but not least is a very famous slide of our crisis hotline. This is the conduit of our people of Guam. I wish all the people of Guam, as well as all of our senators' office, to make this available to your constituents. This is the hotline in which our people of Guam will be able to get the help that Guam Behavioral Health, Guam State Mental Health and Substance Use Authority will be able to provide and exist to provide. And so with that, I conclude my presentation. Thank you.
Thank you, Ms. Arreola. Well, I was going to ask you a question about federal assistance funds, but you have identified that on your slides, so I'm going to skip that. Do you have any prior year obligations? Personnel and so forth, and you are aware that in the Budget Act of 2021,
Yes.
you're allowed to pay it off. I'm hoping you do have some funds to pay it off.
Yes. Thank you, Mr. Chairman. Yes, we do. Actually, these are obligations that I inherited back in 2006, 15, and FY 15 and 16, a total of $46,000. BB&R and I are already processing that prior year obligation.
Just $46,000?
$46,000.
Okay. Thank you. Let me see. Does your building have building insurance of full coverage? Does this typhoon and earthquake? Your buildings?
Yes, sir. We have, we pay $30,000 a year, and that includes all our buildings. So that's 5 Guam Behavioral Health buildings.
Okay, and you got a service contract of $4 million transferred to DISIT. The transfer of the service, what is the estimated cost to staff on this program?
It's a service contract, sir, so really, the vendor would provide the staffing.
Okay. All right, thanks. I don't know if I hope you're aware that this body, the 36th Guam Legislature, has asked the governor to give you, from the ARP, $4.5 million to help offset your shortfall in 2021 Healthy Future funds, and also to carry on and cover you for any other shortfall as a result of the Budget Act this year.
I'm not aware, but I appreciate your efforts.
All right, thank you. I'm trying to find a question for you, but great presentation. Thank you very much. I'd like to also recognize the president of the acting chair of your agency, Senator Sabina Perez, in the absence of Speaker Terlai. Senator Perez, do you have anything you would like to, any questions or comments?
Thank you, Mr. Chair, and good afternoon, Director and panel that's here today. So yeah, I'm just looking at the budget that was initially submitted. It was 19% less from last year, but it looks like you've adjusted it upwards today, so that's good to see. And just maybe if you can expound about how, to ensure the ongoing compliance regarding the amended permanent injunction, if you can talk about what measures you're doing now to ensure compliance.
Yeah, thank you, Senator Perez. As you know, we were lifted, the permanent injunction was lifted in November, December of 2019. And a lot of that, if you'll read the permanent injunction findings from Judge Marshall, a lot of it has to do with our compliance in the commitment of recruiting proper professional staff. She also mentioned the hiring of our pharmacist was a big factor in her lifting the permanent injunction. And so I have to say that Guam Behavioral Health, being CARF accredited, really makes sure that we, on a daily basis, are client-centered, as well as never below the threshold of national standards for behavioral health and mental health centers. So being accredited really makes sure that we are on top of of those national standards. And everything we do has to be client-centered, client-focused. And so we have regular meetings to ensure that we have monthly CARF compliance is ongoing. And we don't just get ready for accreditation, the year of accreditation. It's literally, we need to show CARF that we've been working since the last accreditation forward in making sure that we're still up to par in the national standards that we are measured by.
Thank you for that response. So client-centered, I like that a lot. The other thing is, so right now, are you requesting any funding for capital outlay?
No.
No, okay. And then from the money that was appropriated last fiscal year, are there any lapses from last year?
Well, we're still monitoring that because we're not done with this year.
Okay.
But yes, there are lapses today. And I can say that, I can't give you a hard number because we are in the recruitment of our psychiatrists. So I know that our psychiatrist positions have not been hired.
Okay, thank you.
So there is lapses. I just can't give you the exact number because we're not done with the fiscal year.
Okay, so yeah, maybe perhaps if you can give us an updated number or a number at this point, you can provide it to the chair. Okay, so the other question is, in the decision package for Healing Hearts Crisis Center, the workload output shows an average of 9 medical examinations conducted since 2020. What is the reason for this number? Is it because the majority of exams take place at Guam Memorial Hospital?
Well, I think you're going to see that for Healing Hearts is a very confidential. 2020 was a very difficult year for referrals. 2020, we were open. Guam Behavioral Health was open throughout the pandemic. Are you worried that it's too low? Is that what your concern is?
Yes.
Well, it's up to the victim to come forward and seek our services. And so we work with Guam, with the police department and VARO and all our partners for sexual assault. But those that come through our door were serviced. Now, it could be the pandemic and a lot of referrals not happening at the time. Lots of things, the pandemic covered up a lot, It's like, for example, a lot of our services, we're bracing ourselves for the school year. You're going to see a lot of referrals for I Maga'hågan Guåhan, the children's division, when school opens. Because children abuse and sexual assault is seen regularly from teachers, homeroom, and in school administrators. And that's when the referrals come in very quickly. It's similar to CPS. They're bracing themselves because once they open up, that's when a lot of the referrals are going to come in. So, all I can say is it might seem like a small amount, but that's the amount of clients that came through our door for a rape crisis.
Okay, so the other thing is, GBHWC notes in its impact statement that, quote, it's constantly facing shortages in critical clinician positions, mostly because lack of qualified professionals on the island. For example, psychiatrists, counselors, pharmacists, nurses. Although the department has made some progress at acquiring the services of these professionals, much more is needed to be done. So GBHWC currently employs only 3 staff psychiatrists and is proposing to fill 2 staff psychiatrist vacancies, 2 psychologist vacancies, 1 clinical psychologist contract. So how many more are needed to improve patient response and care?
So, again, like I mentioned, it's always the concern for psychiatrists and psychologists, but this is a nationwide decrease. It is not about the money, because it's always fully funded. It's just about the availability of these professional services. And so, to address the psychology, that is the reason why we're working through our standing up a Guam psychology internship program for 4th-year college students who are in the track of going into psychology to ensuring that they come back to Guam Behavioral Health, do their 4th-year internship program, and then come back to a position. With regards to psychiatrists, there is, we're currently managing at 3, of course, because of the immediately influx and need. 5 would be great, but we're managing where we can. Again, it's not that it's not a money issue. It's availability of these professionals. So thinking out of the box, we are looking at, and if you look at one of the slides, I think I mentioned Innovatel. Innovatel is a company that provides psychiatry, psychiatry, social worker, and counselors, but through telework, all through online teleconference. So we're looking at them, we're talking to them, seeing how we can pair up. And so we just need to think out of the box. So even though I would love to have a warm body, we may be able to fill those 5 positions, but through telework and through contract work from mainland providers who are willing to do work on Guam, given the time difference.
Thank you for that response. The next question is, what financial investments have been made by GBHWC towards the improvement of retention and recruitment of critical clinicians, and what is further needed? And I know you kind of answered that in the previous question, but perhaps maybe you can highlight your retention recruitment efforts.
Well, we don't have a very high turnover rate. If people leave Guam Behavioral Health, it's either they're retiring and they rightfully deserve to rest now, or they're leaving off island. And unfortunately, with 278 employees, I am constantly seeing either a retirement or I'm sorry to leave GBHWC, but I'm relocating off island. So we have a very good retention rate. Again, I think relatively speaking, I think our staff is pretty happy at Guam Behavioral Health.
Okay. Thank you for that response. Is there a delay time in filling prescriptions that patients are experiencing?
No, not now. In the past, prior to us coming in and me hiring the first full-time pharmacist, there might have been a slight delay because we only had part-time pharmacists coming in after their full-time work. So pharmacy hours were kind of weird. It was like 4 p.m. to like 8 p.m. But as you know, the department was open for services from 8 to 5. So people would have to, or consumers would have to come back the following day to pick up the prescription, which again is not client-centered, and that's one of the reasons why it was a priority of ours in 2019 to fill. So no, right away you get your prescription, you can go to the window and get your prescription.
Okay, the other, I think it came up, another question I have is regarding to your CARF accreditation.
Mm-hmm.
So you said that there are 0 recommendations for all clinical programs, so
Mm-hmm.
congratulations. The other thing was that you received 20 to 30 recommendations. So maybe if you can explain, what does that pertain to?
So the recommendations, the average of 20 and 30, and again, they'll be forwarding the official list to us, are things that they went through certain standards and is mostly in the administrative side of things like policy. For example, a perfect example is one of the recommendations is to ensure that our satellite offices not only had a welcome sign, but just making sure that because it's a satellite office, making sure that people who approached the office after 5 knew that they will be able to go to the Tamuning 24-hour facility. So it was simple changes like that would be considered a recommendation. Another recommendation is right now we have a policy that ensures that inspection of handbags and like purses and things like that are done for clients, but now we needed to add the words and staff and visitors. So it's just to comply, it's very simple things like that. There wasn't a recommendation at all that was very alarming. Again, the key point there was that it would be considered a recommendation if it didn't fulfill the entire national standard as it is written in the CARF accreditation book. And so that's a perfect example. Like CARF accreditation national standard requires that not just patients and consumers, but staff and visitors go through an inspection to make sure there's no drugs or contraband. But because our policy as written, we did have a policy, but the policy as written did not have staff and visitors, we got dinged for that. That would be considered a recommendation. So it's simple things like that.
Okay, thank you for that response. One more question. In regards to, drug rehabilitation, and congratulations on the opening next week.
Next week.
As you know, we all know that we have a chronic problem of drugs here on Guam, and is there like a strategic plan to address that with GBHWC and other agencies, health agencies?
Well, I know that at Guam Behavioral Health, and it's a priority for the administration, and that is the reason why the cottage home that is it was initially a DYA cottage home that was underutilized and frankly just wasting away, was repurposed and going to be moved to Guam Behavioral Health so that we can have more recovery residential beds. We recognize, the administration, Guam Behavioral Health, we all recognize that the pandemic in our shores prior to COVID was our drug pandemic of ICE. And so it's predominantly ICE, I should say. So, we have been dealing with a 30-year-old pandemic. And thankfully, one of those blessings that COVID gave us is that there's a lot of financial dollars now to be able to address that. And it's very obvious because we're getting a lot of mental health block grant supplements. We're getting a lot of SAPT, which is the substance abuse block grant. I think there's 3 or 4. This is like the fourth supplemental. So really the Biden administration kept their word and made sure that mental health and substance use is going to get a lot of funding. But to answer your question, the strategic plan is to provide more prevention. You're going to see that in the 148,000 under the Mental Health and Substance Use Fund. That's an increase in the contract side. That's where it's going to go. It's going to go into prevention. And it also dovetails with the island being now marijuana is adult marijuana is approved. And so, with that in play, we have to take that into effect. And so it's not just alcohol, drugs, it's now youth marijuana usage because it's abundant and easier to find, kind of similar to tobacco. Because tobacco is legal, you have a lot of cigarettes lying around family homes, and now that marijuana is legal for adults, don't think that the teenage kids don't see where it's at or where the plants are growing or things like that. So, we need to mitigate those things. So the pandemic is really the drug pandemic, and thank goodness that the COVID pandemic has allowed some federal funding to assist.
Thank you. And do you have a counterpart in DOE that can help with the prevention?
Oh, absolutely. So we're very closely knit with Nadine Cepeda. She's the school district psychologist. We work very closely with her, especially Carissa, who, my deputy, she sits in the Lieutenant Governor's School Safety Task Force, and so that's focused on prevention, not just physical safety, but prevention work in the school. Nadine and Carissa, they're also trainers for mental health first aid training that you folks provided funding for. So we work very closely with Nadine Cepeda. And I just want to say, and I did not mention it, and I should have mentioned it, and thank you for bringing up schools, is that one of the proposals that I presented to the governor and lieutenant governor is called a school safety app. The school safety app is going to be a game changer. And the administration is very supportive of it. We've been talking about it for the last month and a half, and I've been assured that the school safety app is going to be funded. What is the school safety app? It's, like I said, it's going to be game changing. It's an app that we're going to encourage all middle and high school students to download and safely with, autonomously, not, they won't be bullied because they're reporting, but they'll be able to report things like there's a fight after school, somebody is thinking of committing suicide. Kids know a lot of things. They hear a lot of things, but they are afraid to report to authority because they don't want to be targeted. So this school app is a school app that I discovered in 2019 in one of my first national conferences. And Utah, you can look it up, it's Utah School App, Safety App, and it has saved lives. And if we can do this, which all indication shows, and actually I had sent this to the superintendent, John Fernandez, who immediately emailed me back and said, Therese, whatever you want, this is an automatic partnership and we're ready to support. But we're excited about that, and the governor has committed to finding money for that, and it's going to be game-changing for our kids because they're going to be able to report things like kids planning to hurt themselves, suicide, kids who have been abused and telling a fellow friend, and the friend not wanting to do something, but they don't want to get in trouble for telling. They'll be able to report it through the app that's not traceable. And the proper authorities will be linked into that app. For example, if the student is from JFK, for example, then the JFK authorities will be alerted. And so the approach of this child would be more sensitive in the classroom because they know the people who need to know, the responsible adults who need to know, will know what that child is going through, whether it's sexual abuse at the home or physical abuse or thinking of taking their own life or fights and gang fights. Kids want peace too, right? But they're just afraid to tell proper authorities because they don't want to be bullied themselves. So this will protect them and yet get the help they need for those who are silently crying out for help in different ways.
Right. Thank you for the responses. Thank you, Mr. Chair.
Thank you, Senator.
Thank you, Senator Paris. Senator Amanda Shelton, do you have any questions or comments for this panel?
Thank you very much, Mr. Chair, and it's very exciting to hear about this app that's to come in partnership with the Department of Education. I wanted to ask if you could elaborate more on the youth mental health first training, how that's going with school personnel and administering that training to them. If you can give an update, as that was established by Public Law 3540 in the last legislature.
Senator, I am going to pass the mic to my very capable deputy, Carissa, who I guess, again, she's not only a mental health first aid trainer, but she oversees this and in partnership with Department of Education through the Lieutenant Governor's School Safety Task Force. So
yes,
she
please.
can answer that.
Thank you. So for the record, Carissa Pangilinan, Deputy Director. Thank you, Senator Shelton, for that question. You were here at the public hearing when I testified for the bill. So due to the pandemic, we actually, of course, the training has to be in person. And so in 2020, all training kind of came to a stop. But I'm happy to report that as of April this year, we started, smaller classes in person. And then because of the pandemic also, the National Council on Mental Well-Being actually created a new curriculum, and so part of it is virtual. And so one of the biggest challenges that, if you recall, a couple of years ago was that it's really hard to get teachers, for example, to be in a room for 8 hours for this training because you're taking them away from the classroom. So the new curriculum is called Mental Health First Aid 2.0. 3 hours of it, the first 3 hours is virtual. It can be done prior to your scheduled in-person training, and it's at their pace. And then we would have 5 hours of in-person training. And so we're looking forward to the new school year opening. As Teresa Ariola mentioned, we have DOE trainers as well. And so Nadine and her team, there's about 4 of them at DOE. We have about 16 certified youth mental health first aid trainers. So the 20 of us as a cadre would be tackling this together. And these are for the school personnel. On the other hand, and this money will go towards that, it did also last year, pay for 16 certified what's called teen mental health first aid. So this was a brand new curriculum and it's now aimed at teaching students how to intervene with their peers. And so the requirement though is that the schools have to have at least 10% of their school personnel trained in the youth mental health first aid, because if a student is going to report or intervene, on behalf of their peer, the adults who receive them would need to know what to do as well, right? So we spent about $45,000 last year. The National Council conducted the training virtually. And so we have both DOE and Guam Behavioral Health as part of that 16-person cadre. So it has to be done in the classroom setting. We are piloting it with John F. Kennedy High School because they do have at least 10% of their staff certified in the youth mental health first aid curriculum, so they meet the criteria. And we're looking forward to school year, of course, when everybody comes back in person, to implement that for the first time on the island.
Great. I think that kind of progress is something really positive that we need to hear right now coming out of the pandemic, and knowing that we've been able to adapt, and the national trainers have been able to adapt as well to allow us to keep this going. So I'm very thankful for that. I know that there is a goal of generating more money at the department through a new fee schedule. And if you could just elaborate, I know you mentioned working on that fee schedule. Can you elaborate on that progress for us?
Sure. So back in 2012, the department had the legislature was able to pass a fee schedule. And so from 2012 to, I would say, 2018, the department not having a focused billing unit, always just the effort, the intention is always good to bill. But as you know, unless you seriously put dedicated staff into something, it's not really going to take place, because billing is a very focused function. So when I came in 2019, I was reported that from 2012 to 18, the department collected $40,000. That's 4 years, $40,000. In 2019, I believe it was February, we picked up our, 2 months into it, we picked up our first claim specialist. We were also able to immediately hire a vendor to do the back billing of 1 year. You're allowed to back bill Medicaid. And we collected hundreds of thousands in that first year. Now, I just want to let the senators know that currently we're only billing medication, because you need to stand up a lot of things before we can bill other services in the department. But the goal is to begin billing everything. I mentioned in the billing slide there, we started talking to third-party insurance companies. I mean, they need to be on board first. Our folks need their licensing and all their credentials have to be uploaded. It's a tedious process. So really, we needed to make sure that the billing unit had its dedicated staff. And so we're constantly billing, but we're only concentrating on pharmacy right now.
Okay. And so do you need more support staff to be able to complete this project?
Well, the staff that we have today, as I mentioned, I think we just brought on our second claim specialist, and we're picking up a third. For 3, we should be okay.
Okay, okay, that's good to hear.
But there's other things like the CMS application, there's different things. You have to, all these things, all these elements have to go into play before we can really robustly go out and bill every service that we have.
Okay, well, we look forward to your progress, and please let us know what additional support you need to
I
make
appreciate
it
it.
happen. Thank you. And I wanted to just take a moment to commend you on the progress that you've made with the Suicide Prevention Lifeline Center, the 988 number, the national number. I think that's great. When I first heard the news break about the federal legislation, I went to the deputy to see how quickly it was going to be in place. So I think that's really great news for Guam to be able to have this additional resource to keep our people healthy and happy and support them the best that we can. So thank you very much for that. And I wanted to also commend you on the witchy progress that you're making, because the Vice Speaker and I sit on the Western Interstate Commission for Higher Education Legislative Advisory Council, and we meet with them often. And Guam is a great talking point, a great example in this national organization that we are a part of, to see a program like ours that we're setting up for this internship program, and to hopefully be an example for other states, but especially for other professions on island that need this kind of push and support to get the expertise here on Guam. And of course, we want to grow them locally and keep them here on Guam. So thank you for all of those efforts.
Thank you very much. Witchy is actually, they're going to be out here in July to finalize the application, and we're going to be, I would say by next year, we would get our first 1 or 2 interns.
That's
And
great.
hopefully, we're reaching out, hopefully they're going to be Guam kids. But
Excellent.
nevertheless, we saw this work in Hawaii. I sit as a board member in the Witchy Behavioral Health Advisory Council. I saw this work in Hawaii, and I said, why can't we do it on Guam? We need to build our own cadre of local professionals.
Yes, absolutely. Thank you very much, and thank you, Mr. Chair.
Thank you, Senator Shelton.
Thank you, Senator Shelton. Senator Brown, I think Senator Duenas came first. Okay, Senator Duenas, do you have any questions or comments you want to pose to the panel?
Sí, Dios más, Mr. Chairman, and Director Arreola, and to your team. Just want to commend you as well on some excellent work, particularly in securing additional funding, and we're thankful as well for the generosity from the federal side. Following up on that question of growing our own, if you will, our local cadre of specialists. So is Dr. Juan Rapadas in any way working with you guys on this effort? He was one of the local boys that first came to work with me at DYA back in 2003. So I just wanted to kind of see if he was involved.
Dr. Juan Rapadas is employed by the courts.
Right.
We do a lot of work together. We will be, as we build up Dr. Mary Fergerger, Dr. Angela Lego, who is our psychologist at the department, as they've been developing the curriculum. They've been engaging Dr. Juan Rapadas, but he primarily reports to the court.
Sure, I understand. It's just a multi-agency. Sometimes, that helps. And just wanted to see if he was on board. I know that when he was at Department of Youth Affairs, that was really his focus as well. Other than providing the clinical services, was to really enhance the clinical team. And so just wanted to see if that partnership existed.
Definitely,
or maybe it's something you would explore.
We talk to him and we partner him all the time.
Excellent.
Dr. Mary, and they're in speed dial.
Great, good work. Also, I noticed, because I know this was an important grant over the years, and maybe it just changed in terms of its title, but the Prevention, Education, and Community Empowerment Peace Grant, is that under a different title now in terms of your organizational chart?
What slide?
Peace Council?
Oh, peace. I'm sorry. Yes. So, similar to New Beginnings is our drug and alcohol. I Maga'hågan is children and adolescent. Peace is our prevention branch and training branch. They're just coined and known by the community different ways. So peace is our prevention branch.
Okay, yeah, I just didn't see it in the organizational chart.
Yeah,
That's
sorry.
why
I just didn't put peace
Yeah.
like I did New Beginnings or I
Sure.
Maga'hågan.
Okay, I just know that it's
It's the
such a
same.
valuable tool that exists within
It's
your
the same
organization.
unit.
Okay, great. So I guess my final, so with FI Maga'hågan, I just wanted to see if, I don't have any budgetary questions just because the presentation looks like you're well supported. And as well as our chairman mentioned, we have made a recommendation as well. So we'll see what the governor wants to do with that. But so on the severely emotional disturbed with our children, I know that was something that we worked really hard on, getting those services here, wraparound services, if I'm going to that. Just wanted to see if we can get an update on that.
Going strong, and we were very well commended during our CARF survey.
Great.
Very, very. Actually, that was one of the strengths comments about the IFA Maga'hågan review, was that we continue to practice in full fidelity the wraparound services.
Awesome. Yeah, many organizations when they've come before us, or we've had meetings off-site with them, whether oversight here or just working with agencies, I always recommend that as a model, simply because that is what got us out of the issues that we had, was that along with the no wrong door approach as well, but just simply that intensity of wrap services. So I'm just glad to hear that.
We might as
really
well
happening.
have everybody on the table
Exactly.
that's handling or that's servicing that child.
Right.
So
exactly.
everybody can hear and better coordination. Absolutely.
Well, good to hear. I just wanted to get some updates, but good work.
Actually, and thank you for asking because it was really highlighted in our survey for IFA Maga'hågan.
Right on. Great
Thank
stuff.
you.
Okay, well, Mr. Chairman, with that, I don't have any questions, and continue the good work. Si Diyos Masi.
Thank you, Senator Dueñas.
Thank you, Senator Dueñas. Senator Brown, any comments or questions for the panel?
Thank you very much, Mr. Chairman. I certainly do appreciate the presentation. It was very informative. You were talking about, with regards to billing, do you have a time frame set on how you were to put in place the formal process of billing for the services that you provide? I think it's wonderful, certainly because of the pandemic and the circumstance we're in, that we're receiving more federal funds, but that may not always be the case. So certainly strengthening the structure of funds going back into the agency, I'm sure, are very critical to sustain the size, because it's even for me, even though I know Guam Behavioral Health has been around a while, I didn't even realize the size of your staffing that you have there until today to register that number. So do you have a timeline in terms of how you're looking at being able to? Of course, there's some probably because of their indigent situation might not be able to pay for services, but how are you, out of the amount of services you provided, literally what percentage are you able to bill for the services that are provided to your department?
Billing. We're talking
Yes,
billing. I'm
yes,
sorry.
yes.
Actually, as soon as all services could be billed. I mean, really, if you look at the 2012 fee schedule, the legislature gave us the ability to. We just haven't. The department has not, because number one, there wasn't dedicated staff, and so I needed to build that up first. And it was actually that's one of those positions that people really should look into, billing and coding, because it's in high demand right now. We're able, as soon as, we can do it today if we had everything lined up. And we're lining them up. Like I said, our application to CMS is being worked on as we speak. Making sure all the proper documents is provided to the third-party insurance companies, and making sure they sign off, that clinicians who sign off on certain services are recognizable and have the proper credentialing. It's called credentialing. And so once all that is done, we could probably start billing I would say as soon as the new fee schedule is approved, and I'm hoping to get that to the legislature by September, hopefully, before the end of the fiscal year. I mean, we have a committee, a review committee, a fee schedule committee already working and coming together, making sure that we're properly, we're going over every possible service that we can bill. And, you know, the goal, of course, would be to not burden so much the general fund, or in our case, the Healthy Futures Fund. But I don't think we're ever going to be without the need, kind of similar to GMH, the need for supplemental, for even if down the road, let's say we bill for everything we can, and we're kind of like GMH, there's a population that doesn't have insurance. And until there's something that tells us we cannot serve them, we're going to serve them, and that's going to be unbillable, right? So kind of similar to GMH, how there's this population that doesn't have health insurance, not on Medicaid or public assistance, but still access our services. So I would say the timeline would be immediate, as soon as most of those ducks are in order, those things. And hopefully, if everything goes well, I would love to start billing for all services in October, in the new fiscal year.
Well, I know you're never going to reach perfection. I mean, it's nice the paychecks are coming in every 2 weeks, otherwise things would be looked at differently. I mean, we're well aware of the long, winding road and history of Guam behavioral health and the receivership and everything. I mean, there's a lot of building blocks that have led to where your agency is today, and certainly many that have contributed to help get things back on track. But definitely, I mean, I do recognize you're never going to get 100%. But I think every step that you can take to become as self-sustaining as possible and offset the burden, because I don't necessarily know we're always going to have the luxury of the money coming in. And it just makes sense. I mean, it's a problem of government. We just, as long as we get paid, we don't necessarily have that incentive. But I'm sure with the other efforts you put in place to enhance the programs that are there, I mean, that you would also look at this as a priority, because it allows you a mechanism to ensure you have revenue coming in. I don't know the dynamics of where the general fund's going to be in a year or two, and right now we're flowing in money, but I don't believe that's going to continue. And as the U.S. economy continues to pick up, I think less federal programs to the magnitude that we've received as a result of this pandemic are going to continue to be available. So certainly the other sources of revenue you have coming in will be beneficial. And then also, I don't like the thought that people just assume because it's a government service that, they don't have to pay for it. And there are many that choose not to, and then, maybe the government will get around to it, maybe they won't get around to it. I mean, maybe you get put on the same list with rev and tax to make sure that, if they're going to get a tax refund but they haven't paid a bill, that they pay for what essentially is a service that's being provided. In your looking at what you have now, certainly the circumstances have happened with this pandemic, and certainly the additional burden it's put emotionally on a lot of people. But in terms of your clientele in general, what do you see just from the highest amount that you receive of issues that come before you? Is it drug-related, substance abuse, alcohol? I mean, if we're just looking at a pyramid tier, what 1, 2, 3, 4, 5, just to give us a general idea of your clientele that do come to Guam Behavioral Health?
As I mentioned, I feel like all the indicators show that our community is ill. Drug use is high. You can see that New Beginnings, our drug and alcohol program, the numbers are high, and we're not even done for the 12 months. Depression, anxiety, if you want to know the top stressors, depression, anxiety, drug-related. That's key. Those are the top 3. So our drug and alcohol branch is very, very busy. The criminal system is showing, because more and more people are picked up and are being referred to us for assessments for the drug and alcohol. So it's just lining up. Drug and alcohol, mental health, anxiety, and depression is big indications. It's also the indications that it's confirmed with the indications of the data in the hotline as well. So depression, anxiety, and drugs and alcohol abuse. And if I had to put it in a 1, 2, 3, can they all be a number 1? Because it's pretty high, all 3.
And then just on average, I mean, with of course, you have individual needs of each patient, but on average, I mean, even with drug treatment, what is your return rate? Because people like to think you just go and miraculously you're cured and
True.
life goes on and it's wonderful.
No,
Just
it
out of
is-
curiosity in terms of, your clients having to come back for further follow-up or further treatment again back in the system because they've not quite being able to,
It is-
break those habits, bad habits that they may have related to alcohol or drug abuse.
it is not unusual to see the same person in recovery 2, 3 times go through programming. It is not unusual. As you know, recovery is it's a self-decision. So many people come to us, come through the system, get DNA assessment, go through, get referred to whether Oasis if they're women or Lighthouse Recovery if they're men. They go through that program. It's maybe 5, 6 months. They come out. If they keep up with their counseling, if they keep up with their outpatient groups, their services, there's a greater chance. But the minute they slip and they don't keep up with the help that they're getting or their treatment plan, the likelihood is they will slip down that slippery slope, find themselves lost for a while, realize they're not alone, come back into the system again and try it again. But you're absolutely right, and it really just, it's a life journey, right? When you're in recovery, they have to work and being sober every day. And one of the best ways to do that is making sure that you keep with your treatment plan. Continue to go to your outpatient groups, continue to see your counselor, continue to build up the factors that make you resist those temptations, those risk factors. I mean, preventive factors, develop those things, because sometimes you see that they do it so well for many, many years, like that this person's in recovery, but you can say he's a success, and then something major hits them 10 years down the ride, like maybe, unfortunately, maybe a death that affects them, or a divorce, and then boom, they're back down that spiral curve. But the best way to do it is a conscious decision to keep doing what works. And if it means a lifetime of group sessions, a lifetime of counseling, then they just need to be committed to that. But yes, thank you, Senator, because it's not unlikely to see people come through recovery path several times before it even sticks.
Sure. No, I appreciate that. I'm sure there's tremendous challenges. Sometimes physical ailments, maybe it's something tangible, but certainly those type of issues or even issues of mental illness that are not visible to our naked eye, it's complicated to understand. I appreciate your presentation, and I certainly look forward, we'll see in October where you are with your billing process, but that's something we definitely would like to see put in place and formalized.
Definitely, it'll be a priority. It's been a priority, and one of the reasons why I think, the government is not an endless pit, and so we need to constantly, as you can see, we're very aggressive in federal grants, and it's been helpful because outside the COVID, we're very aggressive in non-COVID federal grants to making sure that we can move as many local expenses to the federal side. Why not, right? Let's get other people to pay for it.
By all means. Again, thank you for your
Thank you very much,
presentation.
Senator
Appreciate
Brown.
it. Thank you very much, Mr. Chairman.
Thank you, Senator Brown. Ms. Arreola, first thing I got to say is, number one, please extend a thank you to all your staff and all the employees for what you guys have to go through, because I know that it's, I'm not going to talk bad about the management, but I know they're taking a beating from you guys, because you're hard charging. Let's get this
Let's
done.
ask Debbie here. I'm a slave driver, but they love it.
But But you know what? I just want to make sure that they understand that we do appreciate what you all do. Because I'm looking at everything you're trying to reach for. You're looking for grants. You're looking for ways to improve.
Trying our best.
And that's great. And I thank you also for what you guys have to do. For what you ladies, ladies, for what you do. We really appreciate it. I thank you. And I know the body thanks you. Just keep charging forward. And just
Thank
hope
you,
everybody stays
Mr.
safe.
Chairman, and I will definitely relay the message to the staff. But I would be remiss if I didn't say that the department has not grown and has not accomplished so much during my time in the department if it wasn't for the wonderful, dedicated, and professional staff that I have. And I'm blessed. There's nothing else to say. I'm
Yes.
blessed to have a wonderful staff.
All right, thank you, Ms. Ariola. This will conclude the budget hearing. The committee will continue to receive testimony. Please address your written testimony to the Committee on General Government Operation, Appropriation, Housing, and submit it via email to Senator Joe S. and Agustin at gmail.com or to my office located at Rand Care Building, second floor, Suite 3, 761 South Marine Corps Drive, Tamuning, Guam. Sizuz Masi for your attendance and participating in today's hearing, ladies. And for those at home, thank you for watching. This budget hearing on Bill 55-36 COR relative to the Guam Behavioral Health and Wellness Center is now adjourned at 3:23. Please be safe and take care.